If you are experiencing stress, if you are not feeling good, you are seeing those signs and symptoms that I've talked about, the belly fat, the anxiety, the palpitations, the trouble sleeping, all of it, here's where you begin. The first thing you have to do in a state of high cortisol or even low cortisol where you're crushed out is you have to eat consistently. Blood sugar gets thrown off in a state of cortisol dysfunction, meaning you may lose your appetite, right? Because you're so anxious. Or because you're anxious or depressed, you may be craving salt or sugar or fat or carbohydrates, right? Instead, I want you to take one step back and I want you to think about how you eat throughout the day. And instead, let's flip it and just start to feed yourself on a schedule. Maybe program your phone, 8 o'clock, 12 o'clock, 4 o'clock, 7:30, 8 o'clock again. We have to eat at these 3 to 4 hour consistent intervals because cortisol is now disrupting the regulation of our blood sugar. And as that blood sugar is going way up because of all the foods you may be eating that aren't good for you and then crashing way down, guess what? Cortisol dysfunction gets worse. Again, you feel worse. So let's flip that. Let's turn that around and start to eat on a consistent schedule. I really think that's the foundational step when you're dealing with stress and cortisol. So if you don't want to do anything else, at least do that. Time your meals.